So what are you doing?
So our students are going to count out M&Ms and simulate filling a prescription.
Okay. Where are we?
We are in the mock pharmacy at the school.
So right now they're having Farm Future, and basically
It's like for high school students.
it's for high school students to come and want to be a pharmacist. M&M's, you need 20, take one every 6 to 8 hours as needed for happiness. And we're just gonna get them to count.
Okay.
You wanna be in our vlog?
Yeah. Welcome to my counseling station. Master counselor. I don't know how we're all gonna fit in here, but we're gonna wing it.
I know.
Cool.
I mean, I didn't hear it more.
Where did Nikki match?
I just need to put it on the record that I seriously don't like research. Tomorrow is our debate, and I'm debating on if I should even show up. I told Bailey what would happen if all 4 of our tires were deflated tomorrow. What, he's gonna make us debate on Zoom? Am I right? So it's debate day, and I don't have my presentation ready per usual. Duh, why would I have it ready? When would I ever have anything ready? Waiting on Bailey to get here, but y'all, I can't wait to fast forward and it be like 5 o'clock or something like that. I just want to get this over with. It's my last assignment and I just want it to be over with. I'm sick of it. I wish I could explain how sick of it I was, but I think you can just hear it in my voice. I don't think I need to go into detail and be dramatic. We'll just leave it at that. So I can't wait to fast forward at the end of this video and see me celebrating. We'll see. I might be crying. No, I'm going to celebrate. Even if I fail, I'm going to celebrate because it's over. Let's do this.
So I was talking to someone, and I was like, telling them how the pass rate went like down so bad, and how I was really nervous. And they're like, "Psh, you're just the smartest person I know. You're gonna do fine." I said, "Y'all have no idea."
They have no idea.
No clue.
No clue.
Okay.
We're so smart. Y'all got this.
Y'all are so smart.
They have no clue. They
Okay,
have
come
no...
take my test for me.
Or just spend a day with me.
Yeah, come do this.
You're so smart. No, literally. That's what my first vlog said. I'm not smart. And my aunt is like, Kelly, never say that again. And I guess we're smart enough to get by. It's like we're smart enough to use our resources.
Yeah.
But when Donald's like, how does a cyclovir work? I have no clue.
I can look it up for you.
I can look it up, yeah. She put us on blast because I literally said, yeah, we have to learn Latin.
And she's like, what is PO in Latin? Is it per oral? And I was like, good thought, but no.
I don't know. It's like I don't want to hear, oh, you're going to do good. I don't know. I don't know what I want them to say.
I want them to say, yeah, you really do need to be studying. Like, yeah, you probably should study.
For real, don't hype me up.
Don't hype me up. Because this is going to be even more embarrassing.
Today's debate, this is going to be a discussion between almost Dr. Bailey Sellers and almost Dr. Kelly Belgard. I almost called you your maiden name. My apologies for that.
Billy Kilbard.
Should I start that again so you can get the clean?
Sure.
All right, welcome to today's debate. This is going to be a discussion between Miss Bailey Sellers and Miss Kelly Belgard. Sacubitril valsartan should be considered for patients with heart failure with preserved ejection fraction and heart failure with mildly reduced ejection fraction. Bailey taking the affirmative, and we have Kelly taking the contra. We have opening statements, 10 minutes each. We have then first rebuttals, 4 minutes each, second rebuttals, 3 minutes each, followed by cross-examination, which we'll 5 minutes each for that, and we'll have a 10-minute Q&A section, and then 3 minutes each for a closing statement. We'll begin with the affirmative, so please help me welcome Miss Bailey Sellers to.
Today, Entresto or sacubitril valsartan for patients with heart failure with preserved ejection fraction. Heart failure with reduced ejection fraction is LVEF or left ventricular ejection fraction less than or equal to 40%. So Entresto, it's a combination of an ARB and a neprilysin inhibitor. About cost effectiveness, it is more expensive per tablet, but you see the cost effectiveness with the reduced qualities.
And now for the contra.
So I'm going to go over the contra as to why Entresto should not be used for patients. Entresto looks better here. However, these results are not significantly significant. Sorry. We're not statistically significant. The cost for Entresto is $13.76 per tablet, no matter the dose, and it's BID dosing. Therefore, it's $10,000 a year if you're on Entresto. It's really expensive to have Entresto whenever there's not statistically significant changes in those. The outcomes were not significantly. They weren't significant per Entresto compared to valsartan. The adverse events and the high cost make it not worth it. Thank you.
5 minutes to cross-examine the other. At this point, whoever is the examiner is responsible for controlling the flow of the conversation. And she is not only permitted but encouraged to interrupt if she is losing flow of the conversation.
Okay, Kelly. So tell me, would it be appropriate to start Entresto in a patient with heart failure with reduced ejection fraction? Yes or no?
Yes.
The patient that previously had reduced ejection fraction, you wouldn't continue to give Entresto?
I would look at more. I would need like more information.
We're using Entresto in patients with ejection fraction above 40% anyway, so why not use it in this patient population with good results for patients with reduced ejection fraction?
Well, it depends on what results you're looking at. Okay, if you're looking at just the NYHA classes, then yes, because that was the only thing that was significant. But everything else was not. So I don't see why you would use something that's not significant.
Well, there were other statistically significant results. Worsening renal failure.
Was that significant?
Yes. Let's see. Can I refer to notes?
These things are often intense. All right, so Miss Bellegarde.
So let's say we are at the Ochsner Monroe LSU Family Medicine Clinic, and you're in a little room with a patient, and they have heart failure, and it's preserved, but they didn't have hypertension. They just had like at goal blood pressure. Would you still recommend to put them on Entresto?
Are they symptomatic?
Yes.
Then yeah.
Okay. What if they weren't?
If they didn't have any barriers, then I would still put them on it.
Okay, so if they are symptomatic, but their blood pressure is still good, you would still get them Entresto?
As long as they're not hypotensive, I would try them on Entresto.
Better in my head. Do you think it's fair to just assess BNP for evaluating patients to be on Entresto or not?
I think it's a good marker, good indicator.
Yes or no?
Yes.
Why?
Because I think it's a good marker to, tell you what, things to come. It's a good indicator of whether the heart is still stressed or not. If we have low BNP, then that
Okay,
means...
but let's say they have they do not have hypertension. They're
No.
Why not?
I would look at the patient as a whole, look at all their symptoms.
Would you recommend Entresto for everybody?
No.
Why?
If they can't afford it, it's not going to do any good. Then yeah.
So if cost is an issue, you would let them do valsartan?
It's better for them to take something versus nothing.
Okay.
But I just want to know, have you considered that most of our patients are going to be put on other medications targeted towards heart failure reduced ejection fraction anyways, like beta blockers?
What I would say is we would want to prioritize the treatment with Entresto versus beta blockers.
I disagree. I think I wouldn't automatically put Entresto superior over all the other ones, because if you can use a different medication that isn't as potent as Entresto and still keep them on the other medications that they have, because we don't know what they're for, according to your question. They could be important and not just to put Entresto overall.
The quality of life data is actually quite compelling. It seems like throwing that out of the equation just seems a little bit rough. What do you have to say about that?
Yeah, they will be living better and like living more comfortably. Other patients might think it's worth it to switch to something else and save the money, because what if they go into debt trying to afford this medication? They might have similar outcomes in the end. Does that make sense?
Okay.
I pretty much agree with what you're saying. Yeah, maybe the cost of the drug is high up front. Long term, you end up saving money, probably due to a reduction in hospitalizations. You know, you are having better quality of life. You're able to do more activities of daily life. I agree with what you said.
I feel like you guys both kind of agree in the sense that Entresto it shouldn't necessarily be recommended in every single one of these patients.
Like, why keep on that one when it's so much more expensive? Like, yeah, even if they had a good insurance, most likely people around here, it's still going to be expensive. So why keep that one on whenever there's other options available?
Good job, guys.
Thanks.
That was my last presentation.
Hold on.
So looking at everything that we talked about today, I would recommend that Entresto be considered for patients with heart failure with preserved ejection fraction or mildly reduced ejection fraction results. But I think Entresto should be strongly considered.
We did it. It's over.
We did good, he said.
Bailey did really good. I think we both did
Y'all
really
did
good.
great. You did very good.
Y'all did good. All my people talking in my head.
Significantly.
Yeah, that was so ridiculous. I kept saying Entresto was significantly significant.
Oh my gosh.
Breath of fresh
Kelly
air.
grilled me on the price of Entresto. I was like, I don't know what to tell you.
Yes or no? So you would give someone who's poor, I don't even know what I literally blacked out and was just talking.
Yeah, you're like, if somebody can't afford Entresto,
So you mean to tell me if someone can't afford it? Okay, let's back up. She's for Entresto. I am not. Against our will, he just randomly assigned us. And Entresto is $13 a pill. Valsartan is 25 cents. And so she's pro. I was like, so you mean to tell me if someone can't afford it, you would give it to them? And what'd you even say?
I was like, if cost is an issue, then no. I would let them use like Valsartan or something cheaper.
Yeah. It went good though. He was very happy. This is the first time he's had someone have to do a debate. And he said, since we did so well, he's going to do it again for everybody, I guess.
Apparently we did good.
Yeah. He liked us fighting.
In the moment, I did not think it was going very well.
No, in the moment. No, you did really good though. I literally would just stop talking and go, and just stare at the back wall. In my head, I'm like, say something. I just felt like I kept repeating myself.
Me too, especially towards the end, because basically you are at the end.
I don't think there should be 2 rebuttals.
No, one's enough. I feel like I paused, like, I was like, okay.
I think it's longer in your head.
Yeah, it was like long. It felt long.
It wasn't. All right. It's over. I'm so happy. I'm
You're almost
so happy.
done.
Yeah, I'm so glad that's over with. So glad. I literally felt like I could start breathing, like towards the end when I was like, okay, this isn't so bad. So anyway, all right.
Yay.
Just took a nap, feeling refreshed. Listening to the birds chirp. And here I'm outside enjoying. Made myself a little charcuterie board. You know when your brain, you know when you finally get to relax and your brain is like, you shouldn't be relaxing. Get to work. And you can tell your brain, I don't have to. You're wrong. That's how I'm feeling. However, I should be studying for the NAPLEX. But I think I deserve a little break. I need a little break. Like, if I don't take a little break, I'm gonna go insane. More so than I already am. Next up on my schedule, graduation pictures. Aubrey and Dan are supposed to be taking my pictures, I think April 9th. It's a Monday. So, you know what that means. We gotta get on a diet. My goal this year was to like lose 10 pounds or 15 by graduation. But with these last 2 rotations, I've just been too stressed and too busy to think about that. I don't have an excuse. So we're gonna hop on that. No more cheesecakes. But it's fine.
All right.
Dab me up. Ow! Co!
Can we settle this like adults? Can we just shake hands? Can we just shake hands?